Hi everyone, I'm Dr. Joseph Nyandraj. This is Dr. Logic 360, where your health gets smarter and simpler. Recently, I saw a 70-year-old female patient who came to my office because of shortness of breath and heart racing. She has been having these symptoms for the past 2 to 3 days, and she denied any chest pains. She also did not have any fevers or chills, and she reported no swelling in the legs. So when I examined her, her lungs were clear and heart sounds were normal and there were no murmurs on exam. But when I examined her legs, I found that her left leg was swollen and was bigger than the right leg. Her ECG showed atrial fibrillation. So, given her shortness of breath and the swelling in her left leg and the atrial fibrillation, I immediately suspected pulmonary embolism, which is nothing but a blood clot in the lungs. In this video, I'm going to show you what pulmonary embolism is, who gets it, what are the warning signs, how we can prevent it, and how to treat it. A pulmonary embolism happens when a blood clot, usually from the leg, travels up into the lungs and gets stuck. Think of it like this: your blood vessels are like roads. A clot is like a traffic jam blob. And when the blob blocks the blood flow in the lungs, oxygen can't move well. The heart has to work harder. So, why is this dangerous? Because your lungs are supposed to pick up oxygen and send it to the rest of your body. If that system gets blocked, your vital organs cannot get oxygen, and sometimes this could be deadly. So that is why that patient was sent immediately to the emergency room where she had a CT scan of the chest, which confirmed pulmonary embolism. She had a clot in her legs. That patient had a clot in her left leg, and that is why her left leg was bigger than the right leg. The clot traveled to her lungs and caused her symptoms such as shortness of breath and heart racing. Pulmonary embolism is not rare. It is one of the major blood clot emergencies doctors worry about. It starts in the leg, and sometimes people don't even know they have a clot until it reaches the lung, like our patient who did not know that her leg was swollen. Pulmonary embolism doesn't come in like a villain with theme music. Sometimes it sneaks in like, hey, I'm just a little shortness of breath, or heart racing, or a sharp chest pain, which gets worse with breathing. So, who is more likely to get this pulmonary embolism? Because if you know the risk, you can stop the clot before it becomes a disaster. So, here are the big risk factors for pulmonary embolism: prolonged immobility or not moving, like sitting in a long flights for more than 5 to 6 hours, long bed rest after a major surgery or major sickness leading to prolonged bed rest. For example, this patient had a long flight from Greece to US before she started having these symptoms. So possibly her long flight predisposed her to form a clot in her legs, which ultimately traveled to her lungs. So, recent surgery is also one of the risk factors. Not only surgery, any injury is also a risk factor for pulmonary embolism, particularly major trauma. And another important cause for pulmonary embolism or blood clot in the lungs is cancer. Cancer can make blood more likely to clot. And pregnant women before or after the delivery are also more prone to form clots in their blood and pulmonary embolism. Patients taking birth control pills or estrogen supplements also have increased risk for pulmonary embolism. Also, patients who had a blood clot in the past are at higher risk for blood clots in the future. And patients who smoke, who are obese, and some genetic clotting disorders are also risk factors for pulmonary embolism. Now, let's talk about the signs and symptoms which you should be aware of, because this is the part people brush off as gas or stress. Common symptoms of pulmonary embolism include sudden shortness of breath, like in our patient. The other symptom include sharp chest pain, particularly when they take a deep breath, they experience sharp pains in their chest. Then fast heartbeats or palpitations. Sometimes patients can feel dizzy or even faint, and sometimes they even cough up blood. And as in our patients, clues could be in the leg also. They may present with swelling in one leg, or calf pain, or warmth, or redness in their legs. All this symptom in their leg could mean a DVT, which we call as deep vein thrombosis, which is often where the clot starts. So, big warning, if someone has sudden sharp chest pain, particularly if they get worse with breathing and sudden shortness of breath or swelling in one leg, do not sit at home and wait and watch. This is not a Netflix series. You do not need one more episode. Please seek medical help immediately, because a serious pulmonary embolism can become very dangerous very quickly. Okay, now the $1,000,000 question, can you prevent it? Yes, this part is actually very practical. So, how to lower your risk of pulmonary embolism? So, the first and foremost important thing is move often. If you sit for long hours, please stand up at least every half an hour. Your blood needs traffic flow, not a parking lot. So, on long flights, like our patient, or car rides, walk every 1 to 2 hours. If your doctor tells you to wear a compression stocking, please wear them during long travel. If you had a surgery or in the hospital, doctors may use blood thinner shots or leg compression devices, and they may suggest early ambulation. And this is important. Bed rest is not always your best friend. For many people recovering from a sickness, moving safely early is very helpful in preventing clots. Now, let's talk about the treatment. Doctors use blood thinners. They are called anticoagulants. It is not your typical aspirin, because pulmonary embolism is a clotting in the blood vessel. So, aspirin does not work here. So, you need stronger blood thinners called anticoagulants. So, these anticoagulants or blood thinners stop the clot from getting bigger. Common anticoagulants include medications like apixaban, rivaroxaban, or Lovenox. They lower your chance of getting newer clots. Give your body time to slowly break the clot down. So typically they use blood thinners for 3 to 6 months, but some people may need it longer if their clot risk stays high. Sometimes, if the patient is unstable, doctors may use a clot busting medication, or they do procedures with catheters to break up those clots. One important thing is, if you are on a blood thinner, don't stop it on your own just because you feel okay, because the clot may be quiet but not fully done. So let's recap fast. Pulmonary embolism equals to blood clot in the lungs. Common signs include shortness of breath, chest pain, particularly sharp chest pain with breathing, fast heartbeats, dizziness, or fainting. It often starts as a leg clot. Risks include long travel, surgery, cancer, hormones, and immobility. So, prevention includes moving, hydration, and following your doctor's advice. Blood thinners or anticoagulants are the mainstay of treatment. If you learned from this video, please like this, share this with your friends and family, and also don't forget to subscribe. Thanks for joining me. I'm Dr. Joseph Nyandraj for Dr. Logic 360, where your health gets smarter and simpler.